We're really excited about this upcoming project. It's really going to unite research with action. We're starting off with creating new knowledge around immigrant women's health. That'll be done through interviews. Moving on, we're going to be doing focus groups throughout the project to collaboratively discuss the different interventions that we're doing and create knowledge through the group discussion.
We're really excited about this project that we're doing for Women's Exchange. It dovetails very neatly in terms of what we do at the center, which is the empowerment of immigrant and refugee women and other marginalized women as well.
The center serves the high needs of refugee and immigrant women here in East Toronto.
So there's going to be 4 different elements of the Women for Health project. The first, we'll start off with walking. We're going to be introducing the women to walking trails in East Toronto, which is their neighborhood, and they'll really learn about the different opportunities for physical exercise that are right outside their front door, their free activities, and we'll even be translating a walking guide for them so they can have the information in their language at home.
One of the things that the center does is to develop programs and services that are culturally relevant and in the language of the women we serve.
The next activity we're going to be doing is gardening. So it's both as a physical activity as well as teaching women how to grow their own food as a food security component. We'll also be doing women's health workshops with a health professional from a local community health center. So those workshops will really focus on building knowledge around relevant health issues that are identified by the participants.
Health is really integral to what we do. It's part of our programming. That's why we made it an essential component of this program as well.
Lastly, we'll be introducing the women to a really innovative and exciting art technique called Breathlines that uses a really mindfulness approach, and the women will be able to explore their stories throughout that process.
Well, Breathlines is an important component of the project, which is the art component. The art would be led by community facilitators who will ask the women to draw these black lines on paper, and then the women fill in these lines with their own stories, their own narratives, how they deal with health in their own way. It's highly individualized.
We'll also be working really closely with peer leaders to help facilitate and guide the project activities.
Our projects are aimed at reducing the vulnerability and social isolation of these communities by providing them critically needed services that cater towards their needs.
The peer leaders we've selected are foreign trained professionals that are from our community, and they're really looking to gain meaningful experience in Canada. So the peer leader position provides an excellent opportunity for them to learn facilitation skills, about community research, and about producing knowledge around health issues that are prevalent within their community.
Art at Riverdale is integral to what we do. It's in part of a lot of our programming. We have an art gallery for emerging artists on the 3rd floor that we are trying to start. We also did a mural project that involved the community. Basically, we did a whole block of street art that was very engaging. We asked the community members what they wanted to see on the walls, and we came up with a diverse, spectrum of things.
As a volunteer here, I'm really looking forward to working on this project.
As project coordinator of Women for Health, we're really excited to be having this project at our center. Thank you so much to Women's Exchange for the opportunity.
I would like to thank Women's Exchange for giving us this opportunity to do this project. We are looking forward to it very much.